Hi, Tanya. I was want
Hi, Blake.
Hi. I was wondering if we could talk for a bit about something that's been bothering me, actually bothering a lot of us lately.
Mm,
Is that okay? You have time?
sure,
Okay.
sure, absolutely.
Yeah. Um, what I want to talk about is actually how I feel frustrated about by the length of time the urgent patients are being seen. And they're waiting quite a long time. There was an issue even before, pandemic, and now it's been like so much worse. And uh, what was the last straw for me was actually last week when I saw my friend at Sobeys. They have a parent that they waiting for physio to be seen, and based on what she told me, she is in the category of like an urgent patient to be seen, but they've been waiting for 6 weeks now and haven't been called for physio yet. And I felt like so helpless. I couldn't give the explanation, why they've been waiting for so long, because it seems like there is no like a process. We all kind of process the urgent list in a different way. That we all have different priorities. So I don't know. It's been a little bit frustrating.
Mm. So, just thanks so much for bringing it to me because I think, anytime you have to talk to your manager about stuff, it can be a little scary. So, I just want to thank you so much because really, without me knowing that you're feeling this way, it would be hard for us to kind of figure out what we could do to make it better.
Yes.
Can you tell me?
Yeah.
Can you tell me a little bit more about how you're feeling? Because I'm getting a sense too that there's a lot of sort of distress in your voice, and I want to hear a little bit more about how you're feeling about this.
Well, I'm feeling really like frustrated about it. We talk about this very often on our breaks, and I
Mm-hmm.
know that it's been issue for everybody. For
Mm-hmm.
me, it's really frustrating. I feel it's not fair. What I've noticed, but I'm not sure that that's how it is, that if patients are calling and complaining that they're waiting for a long time, they might be seen
Mm-hmm.
earlier than, others who are not calling. It's, I don't know, I was thinking if we can maybe have some kind of a system in place where we all can follow as much as we can, like, the process of, that list of the urgent patients, because it's been really like very, very prolonged waiting.
Do you feel like the team's not kind of following the whole sort of rules around the prioritization?
I mean, I can't say that. I just know that we have differences, and I just don't want to fight, about the patients,
Right.
or fight with my
Right.
colleagues. I know that we are all
Right.
trying to do our best.
Yeah, it is a really difficult situation, and I mean, one of my challenges is I think, could hiring somebody help? The
Oh,
problem is I'm
definitely.
having a hard time finding people. So, how can we sort of figure out a way to manage some of that workload when we know it's difficult to find
I
people to
know, and
work?
I feel that that's probably the best solution, to have a couple of more people, especially we lost one
Yeah.
during the last year. So I don't know, it just feels like we are constantly going and going and going, and there's not enough time. Sometimes I wonder if I'm going to do my job as I'm supposed to, because I'm on a timeline,
Right.
because of the number of people I have to see during the day.
Yeah. Yeah. Do you have a sense the impact on the team? Because it sounds like there's been quite a bit of chatter about it.
We talk about this list very often, I can tell you that, yes, yeah.
Yeah.
I don't know how other people are feeling exactly. I mean, I see that they feel strongly about it, similar to, how I feel.
Yeah. It sounds like it's really taken a toll on everyone.
It's, yeah, because it's been going on for quite some time. We had issues with the waiting time even before pandemic. Now it's just
Yeah.
ballooned.
Yeah. I know. I feel like the whole situation is just so challenging and difficult, and I rack my brain with how to make this better because I want it to be better for you all.
Yeah.
Do you, you know, the other part is I'm not really even sure what the data is telling us. The data that we get is so poor that sometimes I'm not even sure what the problem is, because I'm not able to kind of see what the trends are related to who's seeing who and how we're pulling people through the system.
Yeah.
Yeah, I think it's really. I just know that personally, I'm finding it pretty stressful too. So just trying to figure out how we can kind of come at this problem in a different way.
Yeah. I don't know if we can have some kind of a system in place to help us to decide, which urgent patients we see first. I think that would be great. I don't know. Right now, it feels like it's random, like a.
Right. It sounds like the team needs to come together. I'm wondering if that's one thing that we could do sooner than later, to sit down and figure out how we're managing and whether there's some efficiencies there.
Yeah.
Related to, I feel like I'm a little out of my league a bit with some of the organizational data. So what I can do is I can pull somebody in from quality and decision support to see if they can help us figure out some of our processes and where is the gap? Because I'm feeling like I don't quite understand what the gap is. Yeah. I mean, these are like difficult ethical quandaries, right?
They are, yes, absolutely.
With it feels like no solution, but I would think that with all of our smart minds and maybe a little bit of help from the organization, we could come together and kind of figure this piece out. I suspect everybody across the country is dealing with this too.
Oh, I'm sure that we are not the only department that is struggling with this. Yeah.
And then I think if we come together as a group with a little bit of support, there might be an opportunity for me to go to the director and say, this is, to show her the data, to say this isn't working. And then maybe we're able to get more resources. Like I can actually tell her clearly and be very clear in how I'm going to speak with her about what are the resources we need. Because I feel like right now, I don't know if I could be clear as to what exactly is the key problem, other than we're not seeing our patients in the most timely way.
Yeah.
So she needs data. She needs data to be able to advocate for more resources down the lane.
Yeah. I know that it would be the best solution would be if we could just hire a couple of more people. I don't know if that's possible or not, but that would be very helpful.
It isn't a straight line, right? Because, in this time of COVID, it is very challenging to recruit, as we know. So, but I don't think that I think we can give it another kick at the can. And I also think we need to look at how we're managing those resources, how we're managing our processes within the department to make sure that we're all on the same page. Yes. And I do think that there's some smart minds around the table that could help us. You guys live this stuff, right? And my job is to remove as many barriers as possible to your work. Yeah. So I think that there are ways in which we could work together to kind of sit down and think this. So it's so critical that you brought this to me, because like I said, a lot of people think the manager knows what's going on, but often we sometimes don't hear all the voices, right? So it's so important.
Well, thank you for hearing me, and meeting with me. I feel so much better with just, talking with you about it.
It's great. Good.
Yeah. If, you can let us know, what is in the plan, that would be great. Yeah.
100%. Thank you so much.
Thank you, Tanya.
Okay, take care.